The decision for healthcare personnel to be in the first group to receive the vaccine, I think, was a relatively easy decision for me and the rest of the members of the committee. Healthcare personnel are on the front lines taking care of patients, and protecting them in this time of pandemic is particularly important. And so almost every group that has weighed in on who should receive the vaccine first has identified healthcare personnel at the top of the list. What was a little bit more difficult for me was the decision on residents of long-term care facilities. Certainly, this is a group that suffers the greatest burden of disease. 40% of the deaths in the U.S. have been among persons in long-term care facilities. And I think that information persuaded me to add them to the list of the initial group to receive the vaccine. We had to prioritize which persons we would start with in vaccinating. We've had discussions up to this point about which groups will be next, although we have not formally made recommendations. And part of that, I think, will be guided by the information we hear about each of the vaccines that are being considered for emergency use authorization. And in our meeting last week, groups 1B and 1C, so today we talked about 1A, but 1B were essential workers that would include teachers, people in law enforcement, firefighters, and a variety of other groups. And then 1C would be persons with underlying conditions who are at higher risk of developing complications or dying should they get COVID-19. And that would include persons over the age of 65.